Hi, I'm Alicia. I'm a yoga therapist specializing in pelvic pain, anxiety, and nervous system regulation. Endometriosis affects 1 in 10 women. When pain persists, the nervous system can become sensitized and the body may shift into protective guarding. This gentle movement sequence helps send signals of safety back to the body and supports softening during a flare. We're going to begin on our backs. You might place a little support under your head. And we'll have knees bent, feet on the mat or the bed. Bring your hands to your low belly and just take a moment here and pause. Feel the movement of your breath. In a moment, we will use a specific exhalation, breathing out through pursed lips as though you had your lips formed around a straw. This exhale helps downregulate the nervous system. So taking a breath in through the nose, exhale through pursed lips, long, soft, and slow. Make it gentle. And then do it again and feel as though your body deflates. Let go of some tension. Bringing your attention back to the movement of your breath. Imagine each inhale expanding the belly toward your hands, and each exhale softening your belly. Couple more of these full body breaths. Let's take one more breath in through the nose. Feel the belly fill. Exhale, pursed lips, like you're blowing out through a straw. From here, we'll bring the knees in toward the chest. It could be hands on the fronts of the knees, hands on the backs of the knees, on the thighs. Find what feels comfortable. And we're going to gently rock the body side to side. Rocking is calming to the nervous system. So feel each part of your back as you rock side to side. I like to imagine my back feeling very heavy as I rock through. Taking both knees around the same direction now, we're going to circle the legs and feel that massage move to the back of your pelvis. Reversing. Try to move slowly. Pay attention to the sensation the massage creates. And when your knees come in over the chest again, pause. Hug them in as snug as feels comfortable. And then take a full breath, low and full into the belly. Another breath out through pursed lips. Taking the knees now, we're going to draw them away from each other and circle them around and together. We'll go a few times this direction. Again, thinking of moving slowly. And notice any sensation. I feel a little gentle inner thigh stretch. And then we'll reverse, same movement the other way. When the knees meet, hug them in gently, full body breath up against your legs. Feel the expansion, breath out through pursed lips. This is called cocky exhalation. And then here we'll place the feet back down to the mat. Sometimes the rocking and rolling can make us move around, so make sure you're where you want to be. And here we'll move into gentle pelvic tilts, but we're going to incorporate the breath because how we breathe directly affects our nervous system. So with an inhale, tip your tailbone down, your low back will lift up a little bit. As you exhale, tip your tailbone up to the sky and you'll feel your back touch. I use my hands when I teach, so inhale, tip the tail down. Exhale, tip the tail up. Keep going. This is gentle movement. We're not forcing or straining into either position. Inhaling, tip the tail down. Exhale, tip it up. Few more times. Let's do it once more. Inhaling, tip the tail down. Exhale, tip it up. And release. Let your hips roll back to whatever their neutral position is. And here we're going to heel and toe the feet a little wider than hips. If you're on a yoga mat, you can feel the edges of the mat. If you're on your bed or the carpet, just have your feet wider than your hips. Let your arms rest away from the body. Moving into windshield wipers. I'd like you to only move here as far as feels comfortable, but we're going to go side to side. So inhaling at center. Exhale, let your knees float over to the right. Inhale, bring them back up. Exhale, knees left. So we're going to go side to side a few times. If you want to turn your head the opposite direction of the knees, that's a nice way to get a full twist through your whole spine. Inhaling up and exhaling over. Let's go one more time to the right. One more time to the left. And when you come up this next time, heel and toe those feet back to about hip width apart. And we'll bring the hands back to the belly. Let's use another of those pursed exhales, cocky exhalation. And then just close your eyes or soften your gaze. And spend 1 to 3 minutes here just feeling that movement of your breath, encouraging it to be low and full, breathing your belly up under your hands. If you find this practice helpful, please consider subscribing for more practices for pelvic health and nervous system regulation.